Hello sir, this is Hemant.
I'm Raju.
Is it alright if I take blood pressure?
Yes.
For getting accurate blood measurement, the room should be quiet and comfortable. The patient should sit down quietly with feet on the ground. The patient should avoid caffeinated products and smoking prior to 30 minutes of examination. The arm should be free of clothing, and I'm going to check for any fistula, scars and lymphadenopathy, so it's alright. And I'm going to check for the brachial artery pulse, to check for the viable pulse, and I'm going to place down the hand on the table so the brachial artery is at the antecubital level. Position the cuff and arms, making sure the cuff is about 2.5 centimeters above the crease by measuring with my fingers, and I'm placing the cuff artery above the brachial artery. Is it too tight?
No.
And I'm sliding my fingers to make sure the cuff is not too tight, not too loose. Next, I palpate the radial pulse and I simultaneously inflate the cuff and check for when the pulse stops. The pulse exactly stops at 120 and I slowly deflate and add 30 millimeters to the 120. I place the bell of the stethoscope over the brachial pulse so that I can clearly make out the sounds. Next, I inflate the cuff up to 115. And I slowly deflate, and also I simultaneously listen for sounds. The first sound is heard at 120, the systolic pressure, and the second, the diminishing sound is heard at 60, the diastolic pressure. For accurate measurement, the BP readings are taken a few more times on both arms.
Good morning, myself Jigmeet Singh, and I am going to examine your eye. Now, what is your name?
My name is Dipanshu.
Now, let's start. Now we are doing a physical examination of eye. First, we are doing visual acuity test. We are using Snell's chart. Keep it from patient from 20 feet apart. Now you will close your right eye. From left eye, you will see how much far you can see and which line you can read.
8.
Read it.
D, E, F, P, O, T, E, C.
This means your vision is 20 by 20. And repeat again from the next eye. Now we are doing visual field test, in which we are doing bigger finger test. In this test, we will have a 1 meter apart from each other, and you have to stare in my eyes. I will wiggle my finger. If you see, you will say yes. Okay?
Yes.
Yeah.
Yes. 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 Yes.
Now we will examine your eyebrow, and we will see your eyebrows growth and symmetry, and if there is a lesion or any scratches there. Now we will examine your eyelids. Close your eyelid. I will check if there is edema, rashes or lesions on both of your eyes. It's okay. Now I will do a palpebral feature test. Look forward, and your palpebral feature is normal. Now we are doing lid-lag test for your eyeballs. I will use a pen. I will keep it 20 inches apart from you. You have to focus on this pen. I will take it upwards and downwards. Okay. By this, I will see your sclera between your iris and eyelid. Now we are doing examination of sclera and conjunctiva. I will first raise your eyebrow, then look downwards. Now I will depress your eyelid, look upward. By this, it will expose your sclera and conjunctiva. Now I will examine your cornea. I will shine the light from oblique position, and I will check for the transparency, clarity, and presence, and also in the cornea. Now I will examine your iris. I will shine the light from temporal region, and I will see the color of your iris. Now I will do pupillary light reflex. You have to see into the distance, and into distance I will shine the light obliquely into the eye and observe in the direct response and consensual response from the opposite eye. Now I will check for the afferent pupillary defect, in which I will swing the light back and forth. Now we are doing accommodation test. I will use 2 fingers, and you have to see the near finger, then farther finger. By this we will see the pupil construction and dilation. Now we will do extraocular movement test. Focus on my finger. I will move it in the 6 cardinal direction and making wide edge. And don't tilt your head. Now I will examine red eye reflex by using ophthalmoscope. First I will control the intensity of the light. Then I will focus on the patient's right eye.
Hello, myself Devagrida, one of the second year medical student. Today I would like to examine your ears. Would that okay for you? May I know your name and age, please?
I'm Prabha. I'm 22 years old.
Do you have any pain in your ears?
No.
If you have any doubt regarding this examination, let me know. Inspect the auricle and surrounding tissues for any deformities, tenderness, lumps or skin lesions. I'm going to inspect your auricles. If ear pain, discharge or inflammation is present, move the auricle up and down. Press the tragus and press firmly just behind the ear. Do you have any pain?
No.
Okay. I'm going to examine your ear canal and drum with this otoscope. Is it okay for you?
Yes.
Inspect the speculum gently into the ear canal, directing it somewhat down and forward and through the hairs. Note any cerumen, discharge, foreign bodies, redness and swelling. Now I'm going to perform whisper test. I'm going to stand behind you and speak 3 different alphabets and numbers, and I want you to repeat them when you hear them.
Okay. Three X2. 72.
Now I'm going to perform Bubble test. I'm going to place this tuning fork on top of your head. Let me know whether you hear it loudest on one ear or the other.
Okay. Yeah, I hear it. Yes.
Is it same on both ears?
Yes.
Now I'm going to perform Renai test. I'm going to place this tuning fork on the bone behind your ear. Let me know when you no longer hear the sound and when it stops. Can you hear it?
Yes. It stopped.
Can you hear it now?
Yeah.
Can you hear it?
Yeah. It stopped. Yes.
So which sound do you hear louder?
Over the years.
Oh, your air conduction is greater than bone conduction, so your ears are normal.
Hello, myself Dr. Amrit Sharma. May I know your name?
My name is Chandrasekhar Mishra.
Now I will do the nose and mouth examination. Is that okay with you?
Yes.
First, I will sanitize my hand. Please put your head backwards. So there is no abnormality like ulcer, nasal polyp, and nasal septum is also clear. Can you please remove your specs? Now I will palpate the frontal sinus under the bony ridge, winding pressure on the eyes. Now I will press the maxillary sinus. So there is no tenderness, facial pain, nasal discharge, and smell disorder. I will do the mouth examination. First, I will inspect the lips. So there is no redness or scaliness or ulcers on the lips, and there is no cyanosis, which is pallor of anemia. Now I will inspect the roof of the mouth. Can you please open your mouth? Can you please put your tongue upwards? Now I will protrude your tongue and inspect the lateral margins. Please open your mouth and say ah. So now we conclude that there are no ulcers or CN12 lesions and CN10 lesions. Thank you.
And I'll be examining oropharynx and neck today. So are you okay with it? Yes. So open your mouth. Say ah. Stick out your tongue. So the soft palate is pink and is smooth. Uvula is in the midline, and no ulceration, inflammation, or exudation is noticed in the tonsils, so it's perfectly normal. Okay, so now I'll be examining your lymph nodes. So I'll start with the preauricular ones first. Preauricular, posterior auricular, occipital, superficial cervical, deep cervical chain, submandibular, submantle. Okay, so now I'll be examining your trachea and thyroid gland. So the trachea is perfectly aligned in the mid, which is normal. Can you please look upwards? Here is the thyroid cartilage, the cricoid cartilage, and here I can feel, and here is the thyroid gland. Please have a sip of water. Now swallow it. The upward movement of the isthmus can be observed very clearly. So yeah, there is no inflammation or any sort of tenderness in the thyroid gland also. So it is normal.
Hello, my name is Laika Pagadan. I'm a second year medical student. May I please ask what's your name?
It's Varilation.
Okay, we're going to begin the lung examination now. Can you please remove your shirt? Okay, so first we're going to start with inspection. So can you please cross your arms like this? Yes. First, for inspection, we need to check for any visible scars or any deformities or any asymmetry. Okay, that's good. Next, I'm going to palpate your back, and please tell me if you feel any pain. Okay. I'm going to test your chest expansion now. Can you please take a deep breath in for me? we're gonna test for tactile fermitus now. I just want you to repeat 99,
99, 99, 99, 99.
Okay. I'm gonna progress now. So for this next test, I'm going to have to mark your bag. Is that okay?
Yes.
Okay. Can you exhale completely for me and hold it? Okay. Now can you inhale and hold for me? I'm gonna ask you to take your chest now. Will you please take a deep breath in? Can you please say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Now can you please say E?
E, 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 E.
Okay. Can you please whisper 99? Okay, so that's all good, and that concludes our lung examination.
Okay, thank you.
Thank you.
Hi, my name is Devansh Singh, and I'm a medical student. So I'm gonna examine your heart. Is that okay with you?
Yes,
Okay, so may I know your name?
my name is Athar Singh.
Hi, sir. Okay, so let's start the examination.
Hello, my name is and today I will be examining your abdomen. So for that, I'll be using the stethoscope and my pen light, and I will use my hand also to palpate your abdomen. Is that okay with you? Yes. I'll be needing you to remove the shirt also. Okay. Okay, now I will be inspecting your abdomen. So, abdomen is symmetry. There is no scar. There is no lesion. Your umbilicus is inverted. So I will be checking your epigastric region. I can see the visible of the position. So there is no bulging flank. There is no dilated superficial blood vessel. There is also no spider angioma. There is no pulsation outside the epigastric region. I'll be using my stethoscope to listen to your vowel sound. I can hear the vowel sound, which is a popping and gobbling sound. I will use my stethoscope. I will listen to the breath sound on the aorta, renal artery, iliac artery, and femoral artery. There is no breath sound heard. Okay, now I will percuss your abdomen. Okay, I can hear the tympanic sound, which is a normal sign. Okay, now I'll be doing the flip wave technique, which is to detect ascites. Can you do like this? Yes. There is no flip wave, which is a normal sign. Okay, now I'll be doing the shifting dullness. I'll mark the area where the dullness is hot. You turn to the left side. Okay. Okay, there is no shifting dullness, which is a normal sign. So now I'll be checking the kidney. So I'll be doing the kidney punch. Can you move, sir? Do you feel any pain? No. Do you feel any pain? No. Okay, that is a normal sign. Okay, sir, now I will be doing the palpation. So first I will start with the right palpation. Do you feel anything, sir? No. Can you breathe in? Slowly. Okay. So now I'll be doing the double hand technique for the deep palpation. Do you feel any pain, sir? No. Yeah? No. Yeah? No. Yeah? No. Okay. That is a normal sign. Okay, now I'll be doing the special maneuver. First, I'll be using the rebound tenderness, which is to check for the peritonitis. So, for that, I'll be using my finger. Do you feel any pain, sir? No. Okay, that is a negative sign for rebound tenderness. And now, I'll be checking for the acute appendicitis. So, for that, I'll be using Rosen sign. Do you feel any pain, sir? No. Okay, that is a negative sign for Rosen sign. Okay, now I'll be checking your appendicitis. So for that, I'll be using Sowa sign and obturator sign. Now I'll be using the Sowa sign. Can you move your leg against my hand? Do you feel any pain on the right lower quadrant? No. So now I'll be doing the obturator sign. Do you feel any pain on the right lower quadrant? No. Okay. There is no sign for appendicitis. Thank you.
I am Kritika, second year medicine student. May I know your name?
Gaurav.
Okay.
I will do your liver and spleen examination. Let's start the examination. Can I remove your t-shirt to examine liver and spleen?
Yes.
Did you pee before the examination?
Yes.
Now I will percuss to measure the span of liver in the right midclavicular line to identify the lower and upper border of liver dullness. To palpate, I will first place my left hand behind the lower thorax, lifting up the 11-12 ribs overlying the soft tissue, and place the right hand lateral to the rectus abdominis muscle. Please breathe deeply. Hooking technique may be used in the patient, those who are obese. Please breathe deeply. Assessing the percussion tenderness of the non-palpable side of the liver. Please compare the sensation of both sides. When a spleen enlarges, it expands anteriorly and medially, often replacing the tympani of the stomach and colon with the dullness of a solid organ. First in the percussion, percuss the left lower anterior chest bone roughly from the border of cardiac dullness at the 6th rib to anterior axillary line down to the costal margin. Now I will palpate for spleen. Please relax your abdomen. Now we will check for Murphy's sign. Take a deep breath. Do you feel any pain?
No.
Okay. This is negative Murphy's sign.
Hello, myself Nongrum Jerubillingdo. Today I'm going to take your shoulder examination. May I know your name and age, please?
22 years.
Okay, will it be okay for you if you take your shirt off? Yes. Okay, so before we start, we're just going to sanitize our hand. So for shoulder examination, we will begin with inspection and observation. First, we would like to inspect the symmetry of our patient's shoulders. We will look for any deformities, any scars, any lumps, or any muscle atrophy. And we are going to look posteriorly for any scars or any lesions. So our patient is fine. For palpation, we have to palpate medially from the sternoclavicular joint. We have to palpate towards the clavicle. And here is the acromioclavicular joint. And we have to even palpate on the other side too. Here is the coracoid. We have to palpate the coracoid. We have to palpate the deltoid muscle and the greater tubercle of the humerus. Now put your hand posteriorly. Now we have to palpate the bursa, and posteriorly we have to palpate the scapula too. So now we're going to evaluate the range of motion of the shoulder. So first we'll start with flexion. Take overhead both of your arms. Do you feel any pain?
No.
Okay. Now for the extension, can you turn around and put your hands backward? Do you feel any pain?
No.
Okay. Okay, now adduction. Can you put your hand there? Yeah. Do you feel any pain?
No.
Can you do the other hand? Do you feel any pain?
No.
Okay, now for abduction, just raise your hand sideways. Yeah, the up, overhead. Yeah. Do you feel any pain?
No.
Okay. So now for internal rotation, can you turn around? Turn around backward. Yeah. And then just put your hand opposite to the scapula of the other. Yeah. Do you feel any pain?
No.
Okay. Can you do the other hand? Do you feel any pain?
No.
Okay. Now for the external rotation, can you turn around? For the external rotation, can you bring your hand like this? Yeah. Just face your fingertips towards the ceiling. Do you feel any pain?
No.
Okay. So now we're going to perform for the special maneuver test. So the first, okay, for the knee impingement test, can you turn? I will compress your scapula and I will raise your hand with my other hand. Do you feel any pain? Okay. Can you turn the other side? Do you feel any pain?
No.
Okay. Okay. For the Hawkins impingement test, just raise your hand. Okay. And I'll internally rotate it. Do you feel any pain?
No.
Okay. The other hand. Do you feel any pain?
No.
Okay. For the drop arm test, can you raise your hand sideways? Okay. Okay, and now drop them slowly. Do you feel any pain?
No.
Okay. Now for the empty can test, can you face your thumb downward, and I will put some pressure and you resist it. Do you feel any pain?
No.
Okay. For the infraspinatus test, can you do the same? You raise your hand and face your thumb upward, and I'll put some pressure and you resist it. You feel any pain?
No.
Okay.
Hello, I am Baldeep Singh, second year medical student. Please can you confirm your name?
Jetpreet Kaur.
Okay. So today I will be going to examine your hand and wrist. So can we start?
Yes.
Okay, let's start. First, I will examine your dorsum of the hand. We will look for any swelling, nodules or erythema, any signs of tenderness. Please, now we will inspect for the palmar aspect. Now we will look for the thinner eminence and hypothinner eminence. There is no sign of any muscle wasting. Now I will be palpating your different joints. So first I will be palpating your radiocarpal joints. Okay. Next we will be palpating individually the metacarpophalangeal joint. Next we will be palpating the proximal interphalangeal joints both laterally and medially. Now we will be palpating the distal interphalangeal joint both laterally and medially. So okay, we will continue with both the hands. Now we will check the range of motion of different joints. Please do like this. Okay. So this is the flexion of your wrist. Now do like this. Extension of the wrist. Now try to move medially. So this is the medial deviation or the radial deviation. Do like this. So this is the ulnar deviation or lateral deviation. Now we will be seeing the range of motion of your fingers. Do like this. So this is the flexion of your fingers. Do like this. This is extension of your fingers. Now spread your fingers. This is the abduction of your finger. Do like this. This is the adduction of your finger. Now we will see the movement of your thumb. Just do like this. This is the adduction of your thumb. Do like this. abduction of the thumb. Now move your thumb and try to touch with your fifth digit. Okay, this is the flexion of your thumb. Try to move it. Okay, do you have any pains? Now we will be performing the penal sign. Please, can you show me your hand? I will be tapping your wrist. Just tell me when you feel the pain. Okay? Do you feel any pain?
No.
So, okay, penal sign is no. Now we will be performing the phalanx test. Just copying, okay? Do like this. Do you have any pain?
No.
Okay, so this is the reverse phalanx test. Now, just do like this. So this is the phalanx test. Do you have any pain now? Okay, thank you. Today I have examined hand and wrist objectively. So on inspecting the hand, there was no sign of any deformity, swelling, erythema or any scars. Range of motion was normal. Sensation was also normal. So in summary, it was the normal.
Hello, myself, Madam Lalu. So today I'll be performing the knee examination. So before that, I would like to know your name and age, please.
Jeremy, 22.
Okay. So before that, I would like to sanitize our hand. So we can start on the examination. For knee examination, ask the patient to be in spine position so that he feels comfortable. The first thing is to inspect. First, we inspect for any deformities or tenderness or erythema. For palpation, first we have to palpate if there is any deformities or not. The first thing you have to look is the medial meniscus. The medial meniscus, the suprapatellar pouch. In this, you have to move. You have to keep your hand 10 centimeters above the patella and move medially. And so the next is the range of motion. In this, you have to inspect the flexion, extension, internal rotation, and external rotation. As you can see here, it is quite fixed, so it is normal. The next test I'll be performing is a special maneuver. The first one is a McMurray test. In this, I'll flex the knees fully and I'll rotate valgus in rotation. As we can see that the knees are fixed, so it is normal. The second is the drawer sign. In this, I'll flex the knees, and this I'll pull the knees posterior and anterior. As we can see that the knees are fixed, it is normal. The third test is the varus test. In this, I will abduct the hip and one hand medially on the knees and the second hand on the ankle, and I'll rotate. As we can see that it is quite fixed, it is normal. The fourth test is the valgus test. In this, I'll flex the knees at 30 degrees, one hand medially on the knees and the second on the foot, and I'll rotate. As I can see that the knees are fixed, it is normal.
Hello everyone, my name is Himanshu Badaya, March batch medicine second year student. Today I am going to examine the cranial nerves names, olfactory nerves, optic nerve, oculomotor nerve, trochlear nerve and abducens nerve. Hello, what's your name?
My name is Akshay.
So before doing the examination, let's first we will sanitize our hands. Okay, now I am going to test your olfactory nerve. Now I will access your nose. Now hold the nostril with one hand. Hold it and close the eyes. Now smell it. Does it smell?
Yes.
Repeat the same process with the other. Does it smell? What's the smell?
It's a garlic.
Okay. So now I am going to examine your optic nerve. First, we will do the visual acuity test. For that, you will be distancing from 20 centimeter, and we will be using the snail stars. You have to read by cover the one eye with your hand, and now read the letters
E F A T O Z L P E D L E F O T C.
Okay. Now repeat the same process with the other eye. Now read the letters
E F A T O Z L P E D P E C F T.
Okay, it looks normal. Now I'm going to test the quadrant test. For this, I will wiggle the finger. Just you have to recognize. Okay, it looks normal. So now I am going to check your retina using fundoscope. So just for that, make a shield between your eyes like this. Now I'm going to do a flashlight. If you get uncomfortable, let me know. It looks normal. Now I am going to examine the trochlear nerve, oculomotor nerve, and the abscess. For that, I will examine the size of the pupil by the reflex function test. For that, I will use my flashlight into your eyes. If it gets uncomfortable, let me know. Okay, it looks normal. Now I am going to check your extraocular muscle. For that, you have to look at the tip of the pen. I will move, and you have to just follow the tip of the pen. Okay, it looks normal. So the examination is done. Thank you.
Hello, what is your name?
Robin Singh.
Okay, my name is Alok Chaudhary and I am second year medicine student in University of Perpetual Health System Delta, and today we are doing cranial nerve examinations. First of all, we are doing a trigeminal nerve motor examination. Let's proceed. Okay. Clench your teeth. Move your jaw. Okay. Okay, now we are doing, I have this pin. Close your eyes. Okay, when you feel it, just look at where it is. Told me. Okay.
Here, 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 here.
Okay, good. Okay, now we are doing a sensory test for eyelashes. Okay, move your eyes on your right side. Right. Okay, now move your eyes on your left side. Okay, good. Now we are doing cranial nerve 7 examinations, facial nerve examination. Let's proceed for symmetry. Okay, now raise your eyebrows. Raise. Okay, now close your eyes. Okay, now show me your teeth. And them. Okay. Okay, good. Okay, now we are doing CN8 vestibulocochlear nerve examinations. Let's proceed for whisper examination tests. Okay, repeat just after me. 10,
10,
8,
8,
6,
6,
4,
4,
2,
2,
Now again. 6,
6,
5,
5,
3,
3,
7.
7.
Okay. Now I am going to do Rene test. Okay. Okay. Which side do you hit the most?
Equal both side.
Okay. That's good. Now we are doing Rene test. Let's proceed. Which one is the longer?
First side.
Okay. Which one is the longer now?
First side.
Okay, good. Thank you.
Hello, I'm Jisna Nabi, and I am a second year medical student, and I've been asked to check your cranial nerves 9, 10, 11 and 12. So, if I may ask, what is your name?
My name is Anjali.
And how old are you?
I'm 22.
Okay, and what do you do for a living? I mean, do you work or do you study?
I'm a student right now.
Okay, good. Okay, so just let me put on these gloves. Set. Okay, I have observed her speaking and she has no dysphonia or dysarthria. Okay, now let's take a look at your mouth. Okay, open your mouth loud and wide. Ah. Okay, her uvula is midline, is not deviated to any other side. Okay, so now we take a look at your gag reflex, and this would be a bit uncomfortable, so I just, sorry. Okay, I'll be stimulating the back of your mouth, it would be uncomfortable. Okay, okay, let's okay, open your mouth loud. Ah. Okay, now there's a present gag reflex, and so sorry. There's a gag reflex. Again, open your mouth, please. Okay, the palates are rising equally and symmetrically on both the sides. Okay, now we start with the spinal accessory nerve test. Okay, now we test for the spinal accessory nerve. Okay, so we'll start with the sternocleidomastoid muscle testing first. Okay, now I'll be putting resistance on this side, and I want you to push towards my hand. Okay, when she does this, feel for the sternocleidomastoid muscle on the other side. Okay, push against the resistance. Okay, push, 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 and good. And this side, push, 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 and push, and good. Okay, this is okay. The sternocleidomastoid muscles are working okay, and the strength is symmetrical on both the sides. We go on with the trapezius muscle testing. Feel for the muscle with your thumb and your fingers. Okay, the trapezius looks and feels okay. Now, ma'am, I need you to shrug your shoulders upwards and resist my hand. Okay. Okay, okay, shrug, 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 resist, resist, resist. Okay, good. The strength is equal, and the strength is equal on both the sides. Next, we go for the hypoglossal nerve check. Can you please open your mouth? Okay, I'll be inspecting your tongue, and your tongue has no fasciculations. It looks all good. Now, put your tongue outside. Okay, there is no deviation from the normal, no atrophy, no fasciculations. Now, move your tongue from side to side. Okay, the movements are smooth and regular. Okay, you can put it back. Everything looks good with the hypoglossal nerve. Okay, time for some deep tendon reflexes. First, we'll be going with the biceps tendon reflex. Okay, please stretch your hand and relax your hand. Relax, no weight. Okay. Now, first of all, look at the biceps tendon. Wait, let me check. Okay, there it is. Okay. Strike briskly with your hammer on your finger nail and look for the flexion of the elbow. The flexion is light and. Okay. Now for the brachioradialis tendon reflex, stretch your hand, relax your hand, okay, and okay. Now relax your hand, okay. Okay, look for this. Look for the supination and pronation of the hand. Okay, that's it. Thank you. Now we go for some triceps reflexes. Okay, ma'am, I need you to extend your hand, please. Okay, and just flex it. No weight on your hand. Relax your hand completely. Relax your hand completely, no weight. I need to feel the weight, okay? Relax your hand completely, no pressure, okay? That's it. Okay, look at the triceps tendon first, and look for the extension of the hand, sorry. That's it, good. Thank you. Now we move on to the patellar tendon reflex. Ma'am, I need to check your patellar tendon, okay? So, please keep your legs apart, okay? And look at the patellar tendon first. This is the patellar tendon, so relax your legs. No pressure, and strike the patellar tendon briskly with your hammer and see the reflex here. Look at the extension of the knee. Okay. Time for some Achilles tendon reflexes. I need to check your Achilles tendon reflexes. I need you to hit that, okay? Okay, first of all, look at the Achilles tendon, dorsiflex the foot, and here is a very prominent one. Okay, relax your foot now, okay? With the blunt end of your hammer, just hit on the Achilles tendon and look for the plantar flexion of the foot. Now we start with the pathological reflexes. First, we will be doing the plantar reflex one. So, what should we do? Make sure the patient is lying relaxed. Take the blunt end of your neurological hammer or any other blunt object you can get, and stroke the lateral side of your patient's sole to the greater toe. So this will go like this. See, you can see clenching there. And this is a normal plantar reflex. If there was an abnormal plantar reflex sign, that would be a Babinski sign. That would be a Babinski reflex, which would have been seen in infants less than 2 years of age. Now we go on with the ankle pronus test. For this test, make sure the patient is well rested. Partially flex the patient's knee and ask the patient to relax your leg. Relax your leg and take the foot of the patient. Briskly dorsiflex and plantar flex the patient's foot, and quickly hold it in the dorsiflex position. Look for any clonus that can be visible, and if there is a clonus visible, it is a sign of a CNS disease.
Good morning. May I know your name?
My name is Krishnani.
Good to meet you, Krishnani. How old are you?
I'm 24.
Okay. I'm Kavya. I'll be examining you today. Will that be okay to you? I'm going to perform the test that assesses the functioning of your cerebellum. And there are 4 tests. They are finger-to-finger test, heel-to-shin test, dysdiadochokinesia, and rapid alternating movement test. We'll move on to the first test, that is finger-to-finger test. Now for that, all I want you to do is touch my finger with your index finger. Now back your nose to my finger, back your nose to my finger. That's it. Great. Now we'll move on to the next examination, that is for the lower extremities. And what I want you to do is, I want you to start with your heel onto the next leg, up to the knee, just like this, and then back to the toe. I want you to repeat that. You can stop now. Now move on to the next leg. Thank you. That's it. Now we'll move on to the third test, that is dysdiadochokinesia. And what I want you to do is, I want both of your hands on your thighs, and I want you to do this as quickly as possible. You can stop now. Now we'll move on to the last test, that is rapid alternating test. For that, I want you to do this as fast as you can, at least for 10 times. Great, that's it. Now we can rest. We just finished assessing the limb ataxia. Now we'll move on to look into gait ataxia. Please get down. I need you to walk on heel to toe. Please go back. Heel. Please hop in one place with one leg. Repeat please with the other one. Here please bend with one leg. Another one. Thank you. And if you don't mind, I want you to walk towards me. Now you can turn around. Now go back. Thank you. Now we'll move on to our next examination, that is Romberg test. For that, I would want you to stand straight. Please close your eyes for a few seconds. Now I'm going to slightly push you. That's it. Great. Now we'll move on to the assessment of tremors. There are 2 types of tremors, resting tremor and action tremor. We'll be assessing action tremor right now. You can take a seat back. Now I want you to put your arms right in front of you, and I want you to stay still. You can put your arms right now. You can rest now. Now we will move on assessing the last 2 tests for motor function. This helps to find if there is any muscle weakness. The name of the tests are pronator drift test and forearm rolling test. We will move on to the first test, that is pronator drift test now. For that, Krishnani, I'd like you to put your arms right in front of you. And please close your eyes. Extend your thumb as much as you can. Okay, that's right. You can rest now. We'll move on to the next test, that is forearm rolling test. For that, I would want you to roll your forearm like this. Thank you. There isn't any deformity as noted.
Hello, I am Maharajan Bhaskar. Today I am going to examine your sensory function. Perfect. I will ask you some questions. What's your name and age?
I am Giri Prasad. I am 30 years old.
Okay. For that examination, I want you to close your eyes. Is that okay with you?
Yeah, okay.
Thank you. We will proceed the examination. The primary sensation test. First test is superficial tactile sensation test. For that, you have to close your eyes. And you will notify me if you feel the touch of cotton disc. Okay? Did you feel them? Did you feel them?
Yeah.
Did you feel them?
Yeah.
Did you feel them?
Yeah.
Superficial pain test. This will be the sharp. This will be the dull. Okay? Now close your eyes. Did you feel it?
Yeah. Sharp. Sharp. Dull. Dull.
Testing your sensation to vibration. Now I am starting this uniform and place it on your bony prominence. Okay? You should tell me if you feel it or not. Okay? Now close your eyes.
Yeah. Yeah. Yeah.
Position sense. For this, I will move your toe up and down. You have to perceive the movement what I perform. Okay? Now close your eyes. This is
Up.
This is
Down.
This is
Down.
This is
Up.
This is
Down.
For cortical and discriminatory form of sensation, first test is 2-point discrimination. Okay? For that, I will place this paper clip on certain place on your places of your arm. You have to tell did you feel 1 point or 2 point. Okay? Now close your eyes.
1, 2, 1, 2.
The point location test, I will place the tip of the pen on certain place of your arm. You have to tell me where did I touch. Okay? Just close your eyes. Close your eyes. Close your eyes. Close your eyes. Asia, I will write certain numbers on your hand. You have to tell what did I do. Okay? Just close your eyes.
3.
Okay. 6. Extension phenomena test. I will touch your arm with my index finger. You have to tell that is one side or two side. Okay? Now close your eyes.
One side. Two side.
The function is normal. Okay.
Good morning, myself Dr. Kunal Saraswat, and now firstly you will sanitize your hand. Okay. So today now I am performing motor testing of your lower extremities. Okay. Now let it will be continued.
3.
Now I will inspect your legs. So firstly you will walk around here. Okay, now I will check your muscle tone. So firstly I will jerk the leg. Okay. Okay. So now I will perform muscle extension. So firstly we will check your hip flexion. So okay, so you sit here. Okay, now you will pull up your leg and now you will force against me. Okay, pull up your leg. Okay. Now you will lay down by your back side. Okay, extension. Rise your leg. Now I will place my hand on your back side of your thigh. Now you will force against on my hand. Okay. Okay, now I will present thigh abduction. So I will put my hand here. You will apply force against my hand. Okay, now I will present thigh adduction. Okay, now I will put my hand here. Okay, you will apply force against my hand. Okay. Okay. And now I will present knee flexion. Okay, so I will put my hand here. Now you will apply force against my hand. Okay. So now knee extension. Okay, now I will place my hand here. Here. Okay, now you will apply force against on my hand. Okay. Okay. So okay, now you will straight your legs. So we will continue on foot dorsiflexion. Okay. So I will place my hand here. So you will apply force against on my hand. Okay. Okay, now I perform plantar flexion. So I will put my hand here. Okay, you will apply force against on my hand. Okay, continue.
Hi, my name is Ashwardhan. What's your name?
My name is Sai.
Today we'll do your motor upper extremity function. Can you take a shot? Let's begin with the inspection for any scars, impigmentation, deformity, asymmetry. Let's check for any atrophy. Let's check for your muscle tone. Just make your hand floppy. Relax. Relax. Just relax. Relax. Let's check for your muscle strength. You hold up your hand like this. Try to release me. Action. Test for action. You hold like this. And I pull my side. Just try to resist. And for flexion. And push towards you. Then. Okay. Resist. Wrist extension. Extension. Do like this. Flexion. Flexion. Color. Fingers extension. Just flexion. Just extension. Flexion. Like this. Yeah. Flexion and action. Could you hold your hand on that? Just one hand. Move leg. Yeah. Medium. Then again. Just this side. Like this side. Like this. Middle phalangeal section. Thank you. Everything looks normal. Please complete our session. Thank you.